India and few other nations are in the midst of a huge COVID wave. The increase in number of cases has brought in too many challenges in most countries. More than ever before, oxygen requirements in the hospital and home has gone up and shortages are being reported. Oxygen is now 10 times the price than ever before. Most people do not understand they're wasting oxygen. Today, we are fortunate to have Dr. Sem Lampotang on our channel. Dr. Sem is a professor in anesthesiology in the U.S.A. He was born and raised in the beautiful island, Mauritius. He has bachelor's from UK and has done his PhD from University of Florida. He has more than 30 patents. He will show us a very simple technique of pinching the oxygen tube to save oxygen by up to 60%. This 60% savings is significant. If there is an oxygen cylinder that is good for 3 days, with this technique, this can be used for up to a week. Good news is that this technique already is being used on real patients in India, and doctors have reported oxygen is being saved. This important information is critical whether you're a medical professional, a patient, or someone caring for a patient, or you just want to learn more about this. Without further ado, I welcome Dr. Lampotang.
Hello, namaste. Thank you for having me. We're going. What are we going to do now? You tell me what to do, Raj.
So, I want to welcome those of you who are live and also returning viewers. Thank you for being here. If you're new here and still not subscribed to the channel, I encourage you to subscribe and hit the bell icon so you get a notification when a new video is released. I'm Dr. Raj, an anesthesia doctor, and I work in the U.S.A. This is Health for Kiddies, where we show information that is evidence-based, or in other words, scientifically tested. We don't just provide education, but create health and wellness for you and your family. Comment below with questions or just what you think about this. I'll try to get to as many questions as possible once we are done with the demonstration. I am very excited to know more about this. I'm sure you as well. This useful information that Dr. Sem is going to give us is published online, and I will leave a link to the article in the description below. I also have a few links on other COVID videos in the description below. Do check it out. Also check the medical advice disclaimer in the description. Now on to Dr. Sem. Dr. Sem, so tell us, what made you think of this idea of saving oxygen?
Uh, it's really the news reports from India showing people on oxygen tanks and hearing how these were heartbreaking stories of people using their life savings to buy oxygen at 10 times the price. Uh, and as somebody who works in this field, I know the oxygen, a lot of it is being wasted, even though they're spending a lot of their savings to buy it. And there is technology already in the United States to reduce or eliminate the flow of oxygen during exhalation when you let air go out of your lungs, because you don't need to enrich that air. You just need to enrich the air that comes in. So we thought there should be a quick way to do. Green room.
Sorry about the technical glitch.
Yeah. Okay. Can we continue?
Yes, please.
Okay. So essentially, it's we thought of this because the technology exists to stop oxygen during exhalation when it's not absolutely needed, but it takes time for the technology to be imported into India or places that need it. And this is a way to do it manually, but in a labor intensive way that I'll show. But hopefully it helps while uh, the help arrives, either in the form of more oxygen or oxygen conservers that do the work I'm going to show you, but they do it automatically. So that's what prompted us to have this idea, because we thought there should be something that can be done now until more uh, like equipment arrives in the form of oxygen conservers or oxygen generators or oxygen supplies.
Hmm.
Yeah.
Yeah, no, that's great. This is a very noble work that you have done, and you have, shown this that you can actually reduce. So we were very excited to see if you could demonstrate on how this actually is done. We're really looking forward to that.
Okay, I'll do a demonstration. So I'll be the patient. I'm putting a face mask on. The pictures, I hope you can still hear me through the face mask. The pictures I've seen in India, they don't have this bag. This is the only face mask we had here in our lab. But what you saw in India was simply this, and then there's a line bringing oxygen into the mask, and then the line is connected as you see here. So this is the same line. Uh, this is the same line as you can see, uh, and it's connected to the oxygen cylinder. So first I'm going to turn on the oxygen cylinder with the ranks, and you'll see the pressure go up here. So now I've have a full cylinder, it's about 2000 psi, but I've not set flow yet. I'm going to set flow with this green knob, and it's going to depend in India, but what I've seen is it's very similar. And in addition, in India, they put a water bubbler from the pictures I've seen uh, in the newspapers. So now I'm going to set the flow at 10 liters per minute. If you look here, so now I have flow flowing at 10 liters per minute. I'm going to take this plier, because if I crimp the flow just by bending it with my fingers, it doesn't stop the flow, because inside this tubing there are ridges to prevent the flow from stopping. So we tried. It would have been nice if we could do it with our hands, but it doesn't stop the flow, and I can feel the oxygen still flowing now. So now I'm going to demonstrate and stop talking. I'm going to close the I'm going to pinch the tubing shut when I exhale. And I don't know whether you notice the mask is fogging when I
Yes.
exhale. And if somebody else is doing it, because here I'm simulating to be the patient, and I know when I inhale, but if a relative or friend is doing it for you, they won't know when you're inhaling or exhaling, but they will be able to guess by looking at the fogging of the mask. If you watch my mask, I will exhale. You see how it fogged? So now I'm going to do the demo one more time.
So as I see, you're squeezing the tubing as you're breathing out. Is that right?
That's correct.
Yes.
And that's what And that's what an oxygen conserver does. It's with but an oxygen conserver does it automatically. This one we're doing it manually. It's labor intensive, uh, and some when somebody's sleeping or tired, somebody will have to do that for them if they want to save the oxygen. But it's not anything new in the sense that oxygen conservers already do this.
Mm-hmm.
So what we're doing simply is we're saying because it may take a lot of time. I know some people are trying to help. They're designing new conservers that can be built in India cheaply, but it's going to take time for those conservers to be available.
Mm-hmm.
So this is a way to do this with only a pair of pliers. If you can use a pair of pliers that has a smooth surface. You see where I put my thumb here?
Yeah.
Usually a plier has ridges. This one, it's smooth. There's no ridges. So therefore, there's this likelihood that we will wear out the tubing. You do need to pinch the tubing close to the flow meter. You don't pinch the tubing here. And the reason for that is if you pinch here, the gas will continue to flow into this long tubing and accumulate there and compress so that when you release, you're not really saving as much gas.
Mm-hmm.
So you really want to pinch close to the flow meter.
Okay.
So you pinch right here, not here. It would be more convenient to be doing it here if you're the patient, but unfortunately you will still lose gas
Mm-hmm.
because gas will accumulate upstream of the obstruction. So we want to make the upstream as small as possible by pinching here.
Mm-hmm. So those are two important points, like pinch the tubing close to the oxygen cylinder, number one, and number two, use a plier with smooth edges because if you use a serrated edge plier, then there is a risk of damaging the tubing.
Yes.
Okay.
And if you don't have that, then put a piece of cloth or something on the surface that actually pinches the tube, because it's not common to find this plier, but we had it in the lab, so that's what we used.
Mm-hmm. This is excellent. I have a lot of questions going on in my mind as you showed this. Uh, you know, of course, there are some good comments saying it's a great technique. Uh, you've used this on patient simulator, not on real patients. But are you aware of this being used in real patient scenario?
Yes. So what we did is because we did it only on a simulator, which was helpful.
Mm-hmm.
So this is actually a simulator that was invented at the University of Florida. It
Uh-huh.
actually consumes oxygen, and it's run by a physiological model. So so we tried it on the simulator, but we could not say for sure that it would work. We knew that the equipment side, all we did was manually simulate what a electronic or electromechanical oxygen conserver does. Uh, and then we posted our results online, and a gentleman who had approached a colleague of mine, a gentleman from India, a physician from India,
Mm-hmm.
made him aware that we had done the experiments on the simulator and posted the results online. He went online, looked at it, and he decided he could try it on his patients. And he did, and he replied that it actually works, it actually helps, and he's advising caregivers. And in a later email, he updated us. He said he's done it with hundreds of his patients in what he called domiciliary care or domiciliary management,
Mm-hmm.
and that there is definitely an economy in oxygen by using this technique.
Mm-hmm. Yeah.
It saves oxygen. Yeah.
So domiciliary care is just home care in India, and looks like so doctors have tested this and they have found this beneficial. So that is very good information for our viewers. That builds confidence, so they can actually use this. So who can pinch the tubing? Is this supposed to be someone working in a hospital, or can the patient do this themselves, or who should be pinching the tube?
Right. So like the gentleman in the physician in India mentioned, this is mostly for people at home. but maybe also for somebody who's in a parking lot of a hospital waiting for a bed to arrive, but they have oxygen.
Mm-hmm.
So, so the patient can pinch it himself or herself if they are well enough.
Uh-huh.
And really, that would be the best, like I showed, because they know when they are inhaling,
Mm-hmm.
right? It is tiring. It is like all the time, but the patient does need to sleep or take a break. So then, if there is a relative with them or a friend, then the friend can do that, but they would not know when the patient is breathing in and breathing out. But that's where they would depend on the mask fogging, because what happens is our exhalation has water vapor,
Mm-hmm.
and the water vapor condenses on the mask, and that's why it fogs.
Okay.
So really, anybody can do it, and I don't think it would be logical to have the physician or a nurse do it unless they are really in dire straits and they know they're going to run out of oxygen,
Mm-hmm.
uh, because it would essentially uh, tie up a physician for a long time because it's very labor intensive,
Yeah.
right?
Yeah, it is.
Yeah.
So sounds like if done correctly, this saves up to 60% of oxygen. So that is very significant. You know, if the cylinder is good for 3 days, you can actually make it work for a week, which is a lot of benefit. So do you think we are using too much oxygen? Uh, and how does it save oxygen?
Well, it's again we go back to the existing technology and oxygen conserver. There is a definition of it. It sends you a burst of oxygen when you inhale, because when you're exhaling, which means if all of you who are listening now, like, become very conscious of how you're breathing, you will notice you're inhaling. It's called inhaling, and then you let air out of your lungs. That's exhaling. But when you're exhaling, you could argue, why do you need oxygen? Why
Mm-hmm.
do you need oxygen to be flowing from the cylinder when I'm actually putting air out of my lungs?
Mm-hmm.
You really need oxygen only when you're pulling air into your lungs. So, so there is definitely a waste of oxygen when it's flowing continuously when you're in exhaling, when you're letting air out of your lungs. You definitely need it when it's coming in, when you're pulling air in or gas in from into your lungs. And so that's what regular oxygen conservers do, and that's what we're doing manually.
Mm-hmm. Okay, that's great. So we have a question from one of the viewers. You know, there is a black tie on the oxygen tubing right up top. So the question is this tie on the oxygen tubing needed on all gas flows? Meaning if you're using very less oxygen, do you still need it or do you need it even, irrespective of how much gas is being used?
In our experiments, this is a what's called a slip fit or a push fit. So there's nothing preventing this inlet from popping out at very high flows. And we found about 10 liters per minute is where it will pop out, especially when we obstruct it. Because when we obstruct it with the plier, we're building pressure here, right?
Mm-hmm.
And the pressure will pop, so it will come out, and now you'll be wasting a lot of oxygen.
Mm-hmm.
So to be safe, and this is just a regular zip tie.
Okay.
I don't know whether you can see it. It's just a zip tie. We forgot to cut it.
Yeah.
If you don't have a zip tie, you can put a Jubilee clip. I
Mm.
think it's in India. It's called a Jubilee clip.
Okay.
You can put anything that will make sure it doesn't pop,
Mm-hmm.
right?
Mm-hmm.
But we found if you stay with below 10 liters per minute, it will stay on without the zip tie. But to be safe, if you have it, I would highly recommend putting the zip tie,
Okay.
because
Okay.
you're already in a situation where you want to maximize the oxygen you spent your life savings to buy. You don't want it to waste it. So if you can find a zip tie, maybe even some wire that you crimp around it, it will just make sure it doesn't come off.
Mm-hmm. So we have various different viewers. You know, we have doctors viewing this video. We have people who are not doctors viewing this video. So for people who are not doctors, I just want to say that there are many different sizes of oxygen cylinders. We know this because we work in a hospital. We are medical trained professionals. But for you, so the question to you, Dr. Sem, is there a particular size of cylinder that this needs to be used, or can this be used on any cylinder?
It can be used on any cylinder. The pictures I have seen from India, they were using what we believe, I think is called a J cylinder.
Uh-huh.
What I'm showing you here is an E cylinder.
Okay.
It's I can lift it with one hand. The J cylinder is almost as tall as an adult man,
Mm-hmm.
so it's much bigger,
Mm-hmm.
and it will last much longer. And what we heard in the news report, I heard they're paying $675 US for one J cylinder, which
Mm-hmm.
is exorbitant.
Yeah.
But to answer your question, yes, this technique will work because all of them, they are connecting to a face mask. So we are not dealing with the cylinder itself. The cylinder is just a supply.
Mm-hmm.
What we're dealing with is with the tubing. So however, in whichever part of the world this kind of mask is being used and there's a tubing going somehow
Mm-hmm.
from a cylinder
Mm-hmm.
to the patient, then that's all we're doing. This is the technique. That's it. It's a plier
Mm-hmm.
and obstructing the tubing. So what cylinder is used should not matter. So you should be able to use it with any size of cylinder
Mm-hmm.
as long as you found a way to connect your face mask to the cylinder.
Okay. Okay. Yeah. So as people have names, cylinders are identified by alphabets. We call them E cylinder, J cylinder, B, C, whatever it is. So that's the interesting terminology for cylinders. So the next question is, when should someone start using this, and when should they be stop using this?
Well, I'm not a physician,
Uh-huh.
and I'm a professor of anesthesiology, but not a physician.
Uh-huh.
So so this is given more as a personal opinion, not a medical
Sure.
advice.
Yeah.
Uh, if somebody is already on oxygen, and my understanding is a lot of people in India are self-medicating
Mm-hmm.
because they are short of breath and they are saying, go get an oxygen cylinder to their children. So then, if they're already on oxygen and they clearly have no idea when a bed will open so that they can get a bed in the hospital and get proper medical care,
Mm-hmm.
and the oxygen is really just a way for them to not be short of breath because that's why they self-medicated, then they should probably start doing this as soon as doing the pinching as soon as they are on the oxygen
Mm-hmm.
and see whether uh, maybe what they should do is try it continuously first and see that it helps their shortness of breath,
Mm-hmm.
obviously.
Okay.
And then once they find, yes, it's I'm no longer short of breath,
Mm-hmm.
I'm okay now,
Mm-hmm.
then they can start doing the pinching and see whether there's no difference,
Okay.
right? And if
Mm-hmm.
there's no difference, maintain it because now they're reducing and their oxygen consumption by reducing the waste.
Mm-hmm. So do you think there is any value of using pulse oximeter in this along with doing this technique?
Very much so. Yeah. So again, this is some of the help that is coming. I know of a gentleman at Stanford who's assembled 10,000 pulse oximeters for distribution in India.
Mm-hmm.
I don't know whether they've arrived yet because of the international situation with air cargo, customs, and all that. But yes, so these are little thimble-like devices you put on your finger, and that would be another way to tell you whether uh, you need to add more oxygen or less. But again, another report I just read is in the end there is no set value for for the number, which is the oxygenation of the blood that the pulse oximeter reports. We also call it the oxygen saturation.
Mm-hmm.
The physicians, according to that report, are a bit uh, surprised because the patients are comfortable at saturations that generally we would consider not tolerable. So these patients were on supplemental oxygen, but they were, I can't remember the numbers, but they were clearly below like 80%.
Mm-hmm.
And generally here in the United States in a hospital, if it gets below 95, we get concerned.
Mm-hmm.
But the reports, there were three COVID reports in one of these papers I read, and the patients had supplemental oxygen. One of them was on face mask, I believe, at 15 liters per minute, and but his saturation was in below 80, I believe, if I remember correctly.
Okay. So we've been talking about India. There are a lot of there are many other countries who have been through this oxygen shortage and crisis. So can this be like applicable to all settings where there is oxygen shortage or there is low resource settings? We may have viewers from Africa, um, parts of South America watching us, and what do you tell them?
Yeah, I think wherever you have a situation where the oxygen is extremely limited
Mm-hmm.
and you've been lucky to find a cylinder and you really don't know when you will be admitted to a hospital and the oxygen is there to help you until at an undetermined date you will get into a hospital, then I don't see any reason why you shouldn't try this
Mm-hmm.
anywhere in the world.
Okay.
Because in the end, you're going to have different cylinders, different ways to store oxygen. But if your oxygen supply is finite, is limited, and is eventually going to run out, then to be safe, and you don't know when you will get proper medical care,
Mm-hmm.
then this is a way to make the oxygen last as long as possible to increase the odds you will make it into and get proper medical care.
Mm-hmm. And the technique is about holding a plier and squeezing it during breathing out. Has there been any tiredness with doing it? Is there a limit of how much longer these things should be done?
Yeah, I've done it myself as part of the experiments we published online. So I've done it like 3 or 4 or 5 times. Each time I did it for about 14 minutes.
Mm-hmm.
It's not really that tiring because you're using a plier which gives you mechanical advantage, and this is even a small plier. It's not a very big plier, but it fits nicely in the hand, and in the end, I, I I know personally for me, I sort of got into a rhythm because it's repetitive, and um, and I really when my colleague came into the room as we were doing the experiment, he said 3 minutes left, and I was a bit surprised because I had gone into a you could sort of a trance
Uh-huh.
because it's repetitive. We had the patient breathing at 30 times a minute to
Okay.
simulate somebody who is short of breath.
Uh-huh.
Uh, and I was surprised because I thought I was 3 minutes into the experiment.
Uh-huh.
And he told me, no, you are like 11 minutes into it. You have 3 minutes left. So I was surprised. And
Uh-huh.
I was not tired.
Okay.
But clearly, it's better if you have different people, uh, helping you as you're doing this.
Okay. So, working in India, I'm aware that there are a lot of family members sitting right next to the patient, especially in low resource settings and also in other places. So they can always cycle around. So people can take turns to squeeze this so they don't get tired.
Right.
Okay.
Yes, just like when we do CPR, we say you don't do chest compressions for more than 2 minutes.
Yeah.
They could establish a routine where somebody does it either for 14 or 30 minutes and then they keep swapping.
Yeah. No, absolutely. So I have a question from one of the viewers. So the question is, can we use oxygen concentrator with the 1 to 7 liter capacity as an alternative?
Yes, I think so. Yeah, because then conceivably, if you have an oxygen concentrator, which is, I think it delivers at, I'm remembering from my head, I may get it wrong. I think it delivers like in the 90% oxygen, not 100%. But if you could then use this and make it go to two patients, because now instead of sending all the flow from one concentrator to one patient, and you have more patients than you have concentrators, and you're using this technique, you could conceivably, and we've not tried it, so I'm not suggesting that this is proven. I'm just speculating here,
Mm-hmm.
but I think you could then have one concentrator serve two patients if each one of them is pinching the hose, because then you're because the concentrator just keeps creating oxygen, right? And there is, I believe, a storage for it, but now you could actually share with more people on the same concentrator,
Mm-hmm.
assuming you have enough face masks.
Yeah. So, well, that opens a whole new, thing that if this is can be used for oxygen concentrators in addition to the oxygen tanks, so that seems like a really added benefit because there have been a lot of people buying this oxygen concentrators and trying to use this. There is a lot of this going on right now with all the panic mode of buying and storing and keeping stuff. So that's a very good information, and thank you for that question.
Yeah.
We have another question from one of our viewer, which says, if the flow is set to pulse mode instead of a continuous mode, is there similar or more savings of oxygen?
If it's set to pulse mode, it means you already have an oxygen conserver. So we didn't do any experiments in that context.
Okay.
So this is really meant for the people who we saw in the photographs from India,
Mm-hmm.
where clearly there was no conserver. There was really just a pressure regulator. In addition, in India, what we saw was a bubbler, a water bubbler, and then the mask, the tubing going to the mask. So I don't know how to answer that. I don't know whether it would work or it would make any difference because you're already in pulse mode, which means, and maybe I don't understand what pulse mode means. To me, when I hear pulse mode, it means that it only sends oxygen during inspiration. But maybe there's a different meaning to pulse mode um, that the person asked, the question that the person asked.
Mm-hmm. Well, sounds like if the oxygen is set at continuous flow, as happens with many, home oxygen treatments and many hospitals where there is very less technology, very less resource to take care of, I think this sounds like a very valuable addition to, pinch and conserve oxygen.
Right.
Yeah.
Yeah.
Is there any, if the patient or if someone is breathing fast, is there any difficulties that you know of with pinching and coordinating with the breathing cycle?
We did it at 30. Originally, we started our experiments at 12, and then our medical colleagues said, no, you should really go higher, higher and shallower. So more breaths, but small breaths. So we went from, I believe, initially 800 milliliters tidal volume and 12 breaths per minute to then 30 breaths per minute, 500 milliliters. We didn't have a problem synchronizing at 30. But some patients may breathe higher than 30. We and there maybe there could start to be a breakdown. But what we also found is that because obviously as humans we were not timing the crimping um, perfectly, and it was not only me who did it. There were three other people who did the crimping.
Mm-hmm.
And there's a lot of what we call inter-operator variability. Like when I did it, actually got a reduction of oxygen use of 64%, which is almost at the 67% theoretical maximum, because we set the simulator to breathe to spend 2 times as long exhaling as it spends inhaling. Uh, but the savings varied from about 37% of oxygen to 64%. And so it is clearly A, labor intensive, and B, operator dependent. But even on the very low end, it will save you about 37% oxygen. And on the high end, and part of it would be whether when you occlude, whether you occlude really well. If you don't squeeze the tubing well, meaning you really close it, then the gas could continue to flow, for example, during exhalation. So it is labor intensive, it is manual, it is uh, open to human error or mistiming of the pinching. Uh, but from what we've seen using different people doing the pinching, it reduces the oxygen consumption while maintaining the simulated oxygenation in a simulator. Unfortunately, the physician in India is obviously very busy. He has many sick patients, so he doesn't have the time to actually do the experiments.
Mm-hmm.
Uh, but from what he describes, it works, and but he didn't tell us whether the patients were maintaining oxygenation.
Mm-hmm. Mm-hmm.
But we're assuming they do, or else they would not continue it if they were feeling short of breath with the technique.
Right, right. Well, this is valuable information, because a lot of people are going through paying a lot of money to buy oxygen and struggling really hard to conserve oxygen. We have another question from our viewer which says, can anything else, I think they specifically refer to a plastic piece be used around the tube to regulate flow. I presume this is instead of using a plier, I think.
I'm sorry, I didn't understand the question.
Well, the question is, can a plastic piece be used around the tube to regulate flow?
How would that work? I'm
I,
not sure.
I, yeah, I presume they mean, can anything else, again, I'm just making this up, can anything else other than plier be used to regulate flow?
Yeah, another way you could do it is if you can find it, is to put like a manual valve, right? So you would do this, like a tap, like a water tap. You could
Uh-huh.
put it here. So what you need is a way to interrupt the flow during exhalation.
Sure.
The Ideally it would have been nice. So maybe another way, and maybe that's what the gentleman meant. Another way you could do this is if you put a regular tubing, right?
Uh-huh.
If you put regular tubing that's not anti-kink, then you could do it with your finger. You would actually stop flow by doing this. But with this kind of tubing that comes with this mask, you cannot stop the flow just by doing this with your finger. We
Mm.
tried it, and it's easy to check. You just put this underwater, put this mask underwater when you do it with your finger, and you'll be surprised. You'll see huge bubbles coming out, meaning it's not stopping the flow. And I should also mention, even when we do this, we still see a few bubbles coming out.
Okay. Uh,
So
so
it's not total interruption. There are a few bubbles coming out, but it's significantly reduced as the data show.
So, Dr. Sem, can you elaborate a little more about the bubble thing you just mentioned? So, how to do it, how to check for it?
Yes. So when you are trying to stop the flow, so what you could do is set it up so that it's delivering oxygen, and then you stop it with a plier, and then you take this part and you put it underwater. And if you see a lot of bubbles coming out from the inlet, you know that it's your crimping is not working,
Mm-hmm.
right?
Yeah.
Because it's how you check whether you have repaired your bicycle tire
Mm-hmm.
when you have a flat, right? After you repair it, you put it under water to make sure there is no bubbles. So
Yeah.
it's the same thing.
Yeah.
If you when you close this, you put it under water, and to be clear, you're going to see still a few bubbles,
Mm-hmm.
but it's going to be much reduced compared to just leaving this open and have 10 liters per minute going out.
Yeah.
So that's a very quick, low tech way to see whether you're doing it well.
Mm-hmm. So it's funny you mentioned about the cycle puncture thing because that's exactly what came to my mind. So, if someone is really worried of whether they're occluding the tubing fully, they can always use the cycle puncture or the underwater bubble test to make sure things
Right,
are working fine. So they're convinced that there is still some oxygen flow going on.
right.
Yeah.
Yeah.
So I guess, are there any risks of damaging the tubing? I mean, obviously, people have to be cautious, but
Yes, there is a risk after repeated use, if this is going on for days, that so what we did in the experiments, after we did all the pinching, now we've pinched the same tube probably for about 5 hours. We put it underwater, same thing again. We make oxygen flow through it, and then where we crimp it, we put it underwater, because that's the best way to know whether there's a leak. And there is no leak so far. So I would say if you're going to use this technique and you're getting into a few days, then you might want to see whether you can get another mask as a spare if you end up putting a leak where you keep crimping, right? Another way would be you could start here, right? And then after a day you move further down.
okay, okay,
Just a little bit further down, not all the way to the mask,
sure,
right? You move a little bit further down so
okay,
that you don't weaken the same spot by continuously crimping it.
okay. So that's a good tip. So, how
Yeah.
much distance from the inlet or from where the oxygen is flowing can the clamp be applied?
I think you can use, you could, like I showed you here, you could start right at the top,
Right at the.
right? And then actually maybe what you could do is start here, like about 4 inches
Uh huh.
for a day, and then move up and do this for a day, and then move up and do this for a day, so that you don't use the same spot,
Mm-hmm.
you know. But it would also be helpful to have another one of those masks in case you spring a leak.
Sure, sure.
And
So
it's
do you,
very easy to check if you have. First of all, you most likely will hear it,
mm-hmm,
but if you're not sure, you can put it underwater.
mm-hmm, mm-hmm. Do you recommend changing the tubing at any particular frequency, or is it based on whether there is a damage or something like that?
I think it would be based on damage, because my understanding of the situation is it's a low resource setting,
Sure.
and to mandate changing it when it's
Right.
not necessary could create issues when there's already a lot of resource difficulties.
Mm-hmm,
So I would say, it's easy to check it by putting it underwater. It's
mm-hmm.
very low tech
Yeah.
until the regular oxygen conservers arrive. So this is really a way to help immediately. What I like to call it. It's an immediately actionable thing you can do.
Mm-hmm.
And part of it is colored by a prior project we did last year where we tried to build an open source ventilator
Okay.
for the community.
Mm-hmm.
When we tried to send it to Bangladesh, there was difficulty with customs, how to send it.
Sure.
So then you begin to realize it's not enough to just do the work in the lab.
Mm-hmm.
It may never even get there. And
Yeah.
you spent a lot of time, and now you're struggling with customs and air cargo.
Mm-hmm.
So the idea, partly this time, was saying there's clearly a problem. We keep reading about these horror stories of people dying because of lack of oxygen.
Mm-hmm.
So I said, what can we do immediately that doesn't have need us to ship things to wherever it's needed, where people can do it by themselves.
Mm-hmm.
But it's labor intensive and it's operator dependent and it's prone to human error. But so far, what we've seen, even with a poor operator, you can get some savings.
Yeah, yeah. Now that's helpful. So, on the related note, we have another question from our viewer who says, have you ever come across damage or breakage of the tubing due to frequent clamping with pliers?
Yeah, so far, so part of what we did, and the reason we made the experiments quickly, is we wanted the data out. Like that was the other dilemma we faced when we were doing the ventilator. Part of the test was we had to run it nonstop for 21 days. And we did. But on the other hand, we were saying in 21 days, a lot of things can happen. So what I'm trying to say is we didn't do it for multiple days because to us, it was more important to finish the experiments and
Yeah,
share it
sure.
rather than say, let me wait 21 days because in 21 days, we don't know how many people could have benefited from this but didn't.
Yeah. I guess this gets to the same point you mentioned earlier about changing the place of where the plier is applied, and also if there is a damage to the tubing, that's when someone has to think about changing the tubing, so there is not a loss of oxygen going on through damaged tubing. So
Yes.
it's an assessment they make on site to see how best to approach this.
Yeah.
Yeah. I mean, to your point about helping Bangladesh and trying to get across customs. So fortunately, this technique can be transmitted through social media, and that's exactly what we are doing right now, so that most people can watch this, get benefit out of this, and hopefully save oxygen. I also have a link below of the original publication that Dr. Sem has published. So you can check on it and always comment in the comment section if you have any questions. If there is anything I don't know, I'll always reach out to Dr. Sem for additional information so he can give you the accurate answers to those questions. Let me check if there are any more questions from our viewers. Um, All right. I don't see any questions. Any final thoughts, any final comments, Dr. Sem, about the technique, about the safety, or anything in general?
Um, no, I mean, it's obviously you need to pay attention to the details, like where you crimp, um, and um, and there are low tech ways like doing the water test to see that it's working. Um, I I really don't have any other advice. I wish we could do more,
Yeah.
but this is something that I hope will be used, or no, it has been used. So I hope it will be used more widely,
Mm-hmm.
given the experience in India. I hope the physician who help us will find time to actually document it more so that more people will, because we were not confident it would work, even though the tests on the simulator showed it worked. So it was a big relief when this physician from India said, "Yeah, it works, and not only does it work, I'm confident it works. I'm sharing it with hundreds of my patients."
Mm-hmm.
And now, really, what we want to do is to make more people than his patients become aware of, and not only in India, but wherever this technique might be needed,
Yeah.
because it is low tech, but in a way that's its benefit because it can be a stopgap until better equipment arrives, better supplies, concentrators, etc.
Yeah. Yeah. That's a great point. Again, this video will be available public. And if someone wants to watch this again, you're welcome to watch this in the channel. And again, as I said, post any questions and comments below. So I really heartfully want to thank Dr. Sem and above all the audience for being here and their valuable time and posting all the comments. I want to remind you to hit the thumbs up like button and share the video to help as many people as you can, help conserve oxygen and save lives. Thank you very much.
Namaste.